proning on the wards, they say, oh, I'm so glad I normally sleep on my stomach, but I thought I wasn't allowed to. And so they're really happy that they can sleep on their tummy. So, my name's Erica. I'm an occupational therapist, but I'm the rehabilitation lead for OSMAP. So what I've been doing a lot of since I've been in Fiji has been working on the wards at CWMH, teaching the staff about and the physiotherapists about positioning and why positioning is so important. And I hear that you guys have, some fairly significantly sick patients here in the arena. So I wanted to teach you guys because it's actually a really, really useful tool. Have any of you had any experience with positioning and proning or anything like that? Have any of you tried proning a patient or?
It's like it's not pain.
I'm quarantined for 14 days. She was my roommate.
Yeah.
You know, my cough relieved when I like her.
Yeah.
Even do this.
Yeah. Yeah. I learned about proning at home in Australia, and I didn't have a lot of opportunity to actually put it into practice. And so when I so I learned about the theory of it, but I hadn't had the opportunity to do it in real life. I can honestly say that proning is a bit like a miracle. It is one of the most effective clinical practices that I have ever used in my life in terms of how quickly and how significantly it can support a patient's well-being and improve their clinical status. Okay. Now, what we mean when we say proning is we mean basically lying pretty much properly on your front. So it's not side lying, that's lateral positioning, which is also a good position for our patients. But proning is really being directly on your front, okay? It's okay to have a leg up a little bit, but you really do need to be quite on your front, okay? Can anyone tell me why is being on your front helpful for your breathing and helpful for your oxygen saturation? What do you think?
Anything to do with the lung expansion?
Yeah, a lot to do with lung expansion. Why is your lung expansion better if you're on your front? Now, I don't know about you guys, I'm not making any judgments here, but I have a little bit of soft tissue on the front of my body, okay? I like to eat food, I have breasts. These are all things that if I'm lying on my back, all of that soft tissue, all of those organs are pushing onto my lungs, okay? And so you have your heart, that's also there, that's putting weight on your lungs. If I'm lying flat on my back, my abdominal organs are also pushing up into my diaphragm, okay? All of these things have the effect of making your lungs smaller. And we don't want small lungs, we want big lungs. So I explain it to patients the way that, and it helps me to understand why this process works as well, and that is that if you imagine that your lungs are like two paper bags, yeah? So they're like two paper bags that are sitting in your chest. If I'm sitting up straight, or if I'm lying on my stomach, nicely supported without all of that weight, those paper bags are nice and open. Okay, so I'm getting lots of oxygen and lots of air into all of the spaces in my lungs. What's happening if I'm like this? Yeah. So those paper bags are getting crushed. Yeah. Same thing if I'm like Jason demonstrated before. When you sit a patient up in the bed and then you come back 5 minutes later and they're at the bottom of the bed and they're like this, just nicely in that hollow. What's happening to the lungs there? Yeah. And all of those abdominal organs are being pushed up into the diaphragm and that's closing up. So it doesn't matter what position your patient is, whether or not they're prone or sitting up or on their side, I want you to think about how is this position impacting on their lungs. Is it making them nice and open, or is it putting pressure on them and making them smaller? Okay? That's the principle. Okay? So with proning, there are a few contraindications, and there are a few things that, you know, make patients suitable or unsuitable to be in a prone position. So there's some obvious ones. If someone has an unstable spinal injury, don't try and roll them onto their stomach, okay? It's a really bad idea. Same thing if someone has chest injuries, so rib fractures, sternal fractures, anything like that. If they have injuries to their abdominal organs, so a kidney injury, a splenic injury, something like that, then that's not a time that you want to put them onto their stomach, okay? But for you guys working here, it's unlikely that you're going to have, you know, that kind of trauma, isn't it?
Mm.
Yeah. So the other thing is that with proning in particular, you must start it early, okay? So these guys have done a really lovely job of showing you sort of that initial assessment. Once you've done that initial assessment, if you've got a patient whose saturations are sitting around, you know, between, you know, under 94%, I would be proning them straight away, okay? Because we know that most of our patients with COVID are usually going to get a little bit worse before they get better once they present to healthcare, okay? So don't wait until your patient is hypoxic, agitated, and unable to follow instructions, okay? You want to get in early, okay? Because you want them to be able to understand why you're telling them to go on their stomach, and you want them to be able to stay in that position, okay? I've tried to prone a couple of people who have been quite hypoxic and agitated, and it is a really messy and unsuccessful process. You end up with there's tubing everywhere, the patient's confused, you're confused, you're sweating under your PPE, it's just a bad mess, okay? So you do often need to help your patients, but it is really important that you start early. The other thing is that when you get a patient into a comfortable position, especially on their stomach, is that they actually can relax. So they really often just go to sleep. And it's so important that we support our patients to rest properly, okay? Because having been at the hospital, I can tell you that after 3 weeks of fighting for breath and having a really high rest rate, the fatigue is what really pushes them over the edge of the cliff, okay? If you want to keep your patients here and help them recover without needing to go to hospital, you will do everything you can to increase their oxygenation, and you will do everything you can to help your patients rest, okay? And the best way to do that is by making sure that they're positioned properly, okay? Any questions about that? No?